Hi everyone, this is Neel Raithatha, consultant audiologist and director of WAXscope. Thank you for joining me in my latest video using the WAXscope. And here we have a patient who attended with plugs of dead skin and ribbons of dead skin that I peeled away from their ear canal. And we are treating this patient right here. And this occlusion extends right from the entrance where we are now, all the way to the eardrum. And they do have a slightly inclined ear canal. So most of our ear canals have an upwards trajectory of, I think on average, it's around 32 degrees. And what happens with this patient, as we approach the eardrum, there's a sudden dip. So this patient's got quite a prominent inferior recess. There's a little trench basin at the floor where the eardrum is, and you'll see that at the end of the video. Now this keratin is really a did, so I've just put some medical grade olive oil spray. We wouldn't term this technically a keratosis obturans, but it may well be a pre-keratosis obturans. To be diagnosed with keratosis obturans, the true definition of and hallmark symptom is pain. And keratosis obturans is an epidermal skin plug that forms typically medially, so towards the eardrum and the bony part of the ear canal. And it's essentially skin that has unsuccessfully shed from the ear. So our ear canals and the outermost layer of the eardrum is lined with epidermis skin, and as this skin dies, it migrates laterally towards the entrance of the ear canal, and when it approaches the outer third of the ear canal, the skin starts to shed itself in individual skin cells. And then a combination of this natural migration that I just explained and jaw movements help to expel the skin from out of the ear. In some people, the skin fails to migrate in the normal way. So instead of migrating sideways like a conveyor belt out of the ear, it migrates inwards to the center of the ear canal. And also, as the skin reaches the entrance of the ear canal, it doesn't separate into its individual skin cells, and it remains connected, and you get then a lamellar structure where you got these long sheets of dead skin, and there's layers of these sheets of skin like an onion almost. And with keratosis obturans, the epidermal plug gets so large that it compresses against the canal wall, and it can cause otalgia, ear pain, and a remodeling, a reshaping, if you like, of the ear canal. So, and this remodeling, this widening, it's global, so it's around the complete circumference of the bony part of the ear canal, which this patient didn't have, and they didn't exhibit any pain in the ear. So, but this is mainly all skin. There's not much wax here. So slowly but surely, we're getting deeper in the ear, and I'm using our medium-sized specular, a 4.25 millimeter internal diameter. So whilst you're watching this, I had a really great day today. So my niece, technically she's not my niece, but it's one of my best friend's niece, so I refer to her niece, is training to be an audiologist, and she's just entered her second year, and she's back home in Leicester for the summer break. She's due to go back in a fortnight or so, and she contacted me to see if she could visit the clinic. Now, I don't generally perform many typical duties that audiologists normally would, because I don't prescribe hearing aids anymore. I'm solely more or less focused now on earwax removal and all my training and development of new devices and equipment. But I invited her in any case so she can observe me performing earwax removal, and it was really great to spend the morning with her today. I think she found it hopefully very beneficial, and she was fascinated by all the technology. She was observing me with patience, went through any questions that she had, and it just made me realise how much I actually do enjoy teaching and training. So we invited her back next week as well for another session, And I think she's going to become a really fantastic audiologist. You can just tell she's really dedicated, very knowledgeable for someone who's just passed their first year. I was really impressed. And she was great with patients. And I think that's, if you're getting involved in the medical or healthcare profession, you need to be wanting to do it for the primary reason of helping people and being able to develop a rapport and communicating with your patients and making them feel at ease. And she was brilliant with all my patients. So obviously we introduced her to all the patients, asked for their permission if they were okay for a student to be present, and everyone did. And she really connected with them. And I'm not sure whether she realises how well she connected with them, but that's half the battle, really. So yeah, I think she's going to be a fantastic audiologist in the making. So I'm really pleased, and I'm always going to be here to support and advise her moving forward. So managed to remove that last plug, and that was trapped up against the eardrum. I'm just going to get the eardrum in focus. There's a bit there just on top of the hammer bone. Not really concerned by that. And so as we approach the eardrum, we've got this sheet of dead skin that's still on the canal wall. I'm going to peel this away, and then the eardrum dips as we approach the end of the ear canal. So I'm just using the fine end. And it's quite stubborn skin. And you can see how all the individual skin cells is still interconnected. You can see those waves, those ribbons. And peeling skin can be quite tricky because it can be quite adhesive. And this patient's ear canal, I wouldn't say it's... most people's ear canals are oval shapes. And what I mean by that, it takes on the shape of an American football, or in the UK, a rugby ball, like an egg, an oval. So the height is greater than the width. I would say in this patient, the height and the width were actually very similar. There wasn't much difference, which gave it a very circular anatomy. And obviously when you're used to seeing the normal oval shaped ear, just kind of take a moment just to adapt for that actually in the procedure. So I'm just focusing on the anterior canal wall. I just reduced the brightness there for a moment, just because we are getting a bit of reflection because of the skin. I've just reduced the fine end size even further. And this just provides me with a bit more precision, especially when I'm working close to the canal wall. I'm just going to stretch the ear open again. Past the second bend with the specular on the right hand side. That's the key thing when using a specular for wax removal. We need to make sure you've got the specular in the correct, the most comfortable position for the patient. And it typically means the right hand side of the specular is kind of tucked in from the second bend. And it's not always possible. Someone's got a really bendy and narrow ear canal, but if you manage to get that on the right hand side past the second bend and then straight in the ear canal, it just makes the speculum more stable in the ear, and it provides a better view because you can straighten and stretch the ear canal. You see it's more comfortable for the patient. So now we're just working on the back posterior canal wall. Just some dead skin here. I'm going to just peel that away. You can see it's really adhesive, but I think we do manage to peel this. I'm just going to peel downwards, and we're going to go towards the eardrum in a moment. And the fine end's really good at this because it reduces clarinetting, which is this high frequency squeal caused by the skin being suctioned, and you just get a bit more precision. I'm going to leave it there. I'm going to look back at the eardrum. I'm going to look superiorly, right, kind of a mild attic retraction there. And I'm just trying to look down towards the bottom of the eardrum, but because of that inferior recess can be a bit difficult, but you can see the light reflex there. And this is all the dead skin I removed from the patient's ear, and you can see those sheets of dead skin as well as the plugs, some of them quite dark, especially the ones that are deeper in the ear because it's oxidized. Well, I hope you enjoyed that video, guys, and if you're interested in the WAXscope, please do email info@clearwax.co.uk. Thank you, bye.